and we are recording this session, as you just noticed. And Julie, the Office of Dental Health is at the Missouri Department of Health and Senior Services. And Julie is just a fantastic partner with the coalition and very helpful. We enjoy working with her. She started her public health career in 2001 at the Department of Health and Senior Services in the environmental program, particularly with Missouri Vaccines for Children. She was the program coordinator there. She lives in central Missouri in Wardsville, and she has a husband and 2 children. And you can read a little bit more about her on our website. The full bio is out there. And so, Julie, I am happy to turn it over to you. You have the floor, and hopefully we won't have any technical glitches with your presentation, but we're ready to assist if necessary.
Okay, great. Thanks, Gary. So all I have to do is hit the share screen. Is that correct? Okay.
Then it'll ask you which program on your computer you're trying to share.
Okay.
You got it.
All right. Great. Thank you, Gary. Before I get too much into this, I do want to make sure everybody knows, but Dr. John Dane retired recently. His retirement started February 1st, and we do have a new dental director, Dr. Guy Deaton. He started on Monday, so he is very new. And since Dr. Dane has left and Dr. Deaton is so new, I'm doing the presentation. So I will let Dr. Deaton say a few words. Dr. Deaton?
Good morning to all. Can everybody hear me?
Yes.
Good. Okay. I just want to say hi to everybody and compliment Julie and the staff for helping me get feet on the ground. And I will be making the rounds and touching base with everybody in the next couple of weeks. Feel free to call me at the office and make introductions. And I just look forward to the opportunity to work collaboratively with everyone. Julie, I'll turn it back to you.
All right. Thank you, Dr. Deaton. Okay, so we're going to go over updates for the office, what we've done, of course, why is Tuesday important, state oral health plan, rural oral health, workforce, dental sealants, and then opioids and some Medicaid issues. Obviously, everybody has probably seen this, unfortunately, and this is what we are trying to prevent, tooth decay and caries in children, namely, but for everybody. So that's why we do what we do. It's to avoid issues like this. We all know that tooth decay, affects many different things, diabetes, heart disease, different things like that, and oral health is overall health. So that's why we're here, to improve oral health. All right, this is our state oral health plan. We partnered with the coalition to create this. They coordinated several meetings with a lot of community partners throughout Missouri to talk about different things that we wanted to do as the Office of Dental Health. And if you have not looked at this, please do. It's a great document. There's a lot of things in there that the Office of Dental Health, along with our community partners, will be working on in the next 5 years. It is a 5-year plan. You can find that on our website if you haven't been able to locate that yet. The Office of Dental Health is small, but we have grown over the last few years. We have 5 full-time employees and 7 part-time employees. We have several different programs and contracts and grants within the office. One of our largest one is the Maternal Child Health Grant, MCH grant. And with that, we do our biggest program, the Preventive Services, or PSP program. Many of you have probably heard about that. We provide education, referrals, screenings, and fluoride varnish and oral health supplies to children throughout the state. And I'll be talking more in depth about that. We also the main focus of the MCH grant is to improve oral health in that population, the maternal and child health population. We also have the Elks Mobile Dental Program that is general revenue or GR funded.
Julie, I'm sorry to interrupt, but we are not seeing your slides advance. So I'm going to suggest you end screen share, and then I have a copy of your slides, and I will share those.
Okay.
Okay, am I on the correct slide, and can you see the
Yes,
slide? Okay,
I can.
great.
Okay, thank you. Okay, so the Elks Mobile Dental Program is general revenue funded. It was reinstated this year. It was reinstated a few years ago. There was a little bit of time whenever we thought that the general revenue was not going to be available for it, but they did reinstate the funding for it last year. Hopefully they do again this year. And then we also have our PHHS funding, and with that we do a lot of the community water fluoridation training. We have a contract with the University of Missouri to do training with the water operators, and then we also have a contract with the Missouri Coalition for Oral Health to do education for mainly the general public and other community partners. And then we've also been able to fund some water equipment repair and replacement at some of the water systems around the state. We also have the HRSA competitive 4-year grant, and with that, the main focus was to improve the workforce in Missouri. So we are focusing telemetry on that, and then we also have our WIC fluoride varnish contracts, where we have contracted with the local public health agencies to provide education and to apply fluoride varnish to the kids who come in for their WIC, every child who comes into the local public health agency. And then we also have our CDC competitive 5-year grant. And with that, the focus was to improve oral health outcomes. And we are focusing on sealants and community water fluoridation with that as well. And we have several contracts that deal with those. So COVID-19 effects on the programs in the Office of Dental Health. Obviously, since we have so many programs that go to schools, we have started working with nursing homes. We've started working with the WIC clinics. A lot of those have been closed or closed to visitors, or just operating differently. So a lot of our programs have been affected, as the dentist offices obviously have been too. The stay-at-home order was issued in March. 99% of the dentist offices closed. Well, most regular business closed in March. Everything reopened in May of 2020, very slowly. In December of 2020, there was a little survey done, and 40% of practices are seeing less patients now than they were pre-pandemic levels. I believe it is starting to go up, but it has definitely made a difference, unfortunately. It'll just take a few months, hopefully, before everything gets back to some sort of more normalcy. And like I said, schools and nursing homes were closed to visitors, so it was difficult, or if not impossible, for our contractors to provide services in the schools and the nursing homes. They are trying their best, but sometimes it just didn't happen, because a lot of the schools, especially in the St. Louis area, were virtual or remote only. And of course, a lot of our PSP was affected too because of the PPE shortages. We do the screening events, but we need PPEs to do some of those screenings, just the face masks and gloves. But of course, a lot of dentist offices, and us included, donated some of those PPEs to the frontline healthcare workers who were dealing with people with COVID or doing screenings and testings and different things like that. So there was a PPE shortages that affected the screening events as well. Like I said, the WIC programs, there were no face-to-face appointments, so the contractors couldn't apply the fluoride varnish. It is virtual, and I believe that it will stay the same until the end of March, I believe. So hopefully after that time they can start back with the in-person WIC WIC visits, and then they can apply that fluoride varnish again. And then the clinical activities have also been put on hold. Gary, I've got a gray screen in front of my slide. I don't know what that is, but okay. We can go to the next slide then too. So the PSP, like I said, a lot of that has been affected because of COVID, but I'll give you a little bit of background with PSP in case you didn't know. It started 2005, 2006 with the Missouri Smiles program. It is community-based. We rely heavily on the community, the people in the community, the dental professionals, and even just volunteers who come into the schools to help with the screenings and the fluoride varnish applications. So we provide dental screenings to students 0 to 18 years of age. We also give them dental home care supplies, toothbrush, toothpaste, floss to 4th grade and older, and also some bookmarks, mirror clings, different things like that to remind them about the importance of oral health care. And then we also have some education that we provide. So that's also given during PSP. The fluoride varnish is provided at the time of the screening, and then they also do it 6 months later. The screening is just done once a year, but the varnish is done twice. And then obviously one of the most important things too is referrals. So if there's somebody in need of dental care, the PSP coordinator or that dental professional will refer that child to a dental clinic close by, in most cases an FQHC or a community healthcare clinic. Okay, this slide just shows the participants by school year. As you can see, back in 2005 and 2006, we just had a little bit over 4,300 students participated, and our biggest year was 16-17 with almost 93,000 kids. That is pretty remarkable. Whenever you consider the time frame. So we have grown tremendously. It is a great program. We have awesome staff that do that coordinate this program with the schools and contact the schools all the time. They are our dental hygienists. I'm sure you know them well. Ann, Audrey, Beth, Jeffrey, and Molly. Give yourself a round of applause. You guys do great work in getting the schools and then the kids in those schools to take part in PSP, because we know it is an important one. So we're working on the draft for the 1920 school year. I've got the final draft, and we are trying to get that out there, and it'll be on the website whenever it's done. So this year, unfortunately, we did not quite see 80,000 kids. Schools were closed in March, so that had a big effect on us. It's about almost a 13% decrease from last year. And this year, this current school year is going to be even less than that, unfortunately. Right now, our school participation is about at 20% what it normally is. And most of those schools are in the rural areas of the state. They probably don't have as many as guidelines. Some of the other schools in St. Louis, they're closed just during remote, and some other schools just don't let visitors in. And another problem is they're having a hard time finding volunteers. Because professionals, as you know, you are trying to get your patients back into your office, or you just want to focus on your office. So we are having problems finding volunteers too. We did come up with some alternative strategies for this year. We created some new educational videos for each grade level. If you haven't listened to them, I think they're pretty awesome. We had some PowerPoints that we used, and they just wrote down they wrote a script for those PowerPoints, and then we narrated them and recorded them, and they are out on YouTube. They're also on our website if you'd like to take a listen, but there are several different videos for K through high school. They are great videos. Please listen whenever you get a chance. And then we've also kind of tailored each PSP event to the school's needs. We did agree to send oral health supplies to the schools, even if they are not varnishing or screening, because we thought, the kids still need those oral health supplies. Sometimes those kids, that's the only place that they get a new toothbrush or toothpaste. You know, we've talked about it before. There's been several times when we've given out toothbrushes. You know, a little kid has said, "You mean this is my, you know, I get my own, I don't have to share, or you know, it's the only one in the house." So we felt that it was a good thing to still provide the oral health care supplies to those kids, even if the schools aren't participating in PSP. And then hopefully it's kind of a good faith effort too, that they'll still participate in PSP next year and do the screening and the varnish.
Julie, we're getting an indication that you have a somewhat weak internet connection, so I'm going to suggest that you cut your video so your audio will be a little bit more stable.
Okay. So this slide shows the top 10 schools. This is not the top 10 list you want to be on. I feel kind of like Letterman, although there's nothing funny about this list. This is the top 10 schools with children having the highest untreated decay rate for the 1920 school year. As you can see, there are several Boone County schools on here. And Boone County is a big county. It has lots of big schools. So, you know, you would think, oh, sure, they'd be on here because they have the most kids. Well, there's also some counties on here that are fairly small. Howell, Bates, Oregon, they also had a lot of untreated decay in those schools as well. So this is a top 10 list that we would not like to be on, but these are the top 10 schools with the children having the highest untreated decay for the 1920 school year. So if you are in and around these areas, you might want to check in with some schools, see if you can do some volunteer education, you know, ask them if they'd like to do, you know, more PSP, you know, different things like that. See if there's anything that you can help with possibly. But we just wanted to show these to you just so you knew. Some good news, what we have found with PSP, is that from the 13-14 school year until the 19-20 school year, there has been a 5.3 decrease in decay rate among the PSP kids. Granted, this is a convenient sample. It's not a randomized sample, but it's still a good thing to see. It gives us some hope. It shows us that the program is really working. You know, the screenings, the referrals, education, that's all working. So there has been, you know, over a 5% decrease. So if you take part in PSP, if you have encouraged schools to do PSP, thank you very much, because this decay rate decrease is because of you. So we really appreciate that. You know, keep up the good work. But thank you very much. All right, another slide dealing with the impact of the PSP program. So we looked at the Medicaid rate for the amount of fluoride varnish, and in 2018, the Medicaid rate for the amount of fluoride varnish that we used, it was a little bit over $1 million. Of course, it's not submitted for reimbursement, but I guess you could kind of look at it that maybe we've saved the Medicaid program over $1 million in fluoride varnish. It's quite phenomenal whenever you think about how much that is with what we've done with the PSP program. And again, like I said, the estimated reduction in the dental decay rate among Medicaid patients is 5.3%. And then also another impact of PSP, which people may not have really thought about, but you know, I showed the slide with the top 10 schools there. That gives us those schools that are having the problems with maybe accessing dental care. So, you know, we know where to concentrate those efforts on, and what areas to look at, you know, possibly how do we get those, you know, provide more education or provide something else to them and work with them a little bit more. Okay, so oral health in rural Missouri among school children. I won't read you all of these percentages, but you can see the oral health in rural Missouri. There's a bit more of a need in the rural parts of the state than there is the urban. You know, their need for urgent care is higher. Rampant decay is fewer in rural counties, but their oral hygiene, it's lower in the rural counties. Dental sealants are lower. So, we know that rural Missouri definitely needs some help. And again, it's probably something to do with an access to care issue. All right, moving on to the next slide. We've also done the ELKS survey. I mentioned in the early part of the slide that we have the General Revenue Fund to provide care for the ELKS Mobile Dental Program. And if you're not familiar with the ELKS Mobile Dental Program, Gary, my slide went away. I don't know where it went, but okay. It doesn't matter, but all right, thanks. So the ELKS Mobile Dental Program, it is funded by GR and also by the Truman Medical Center. And the Truman Medical Center runs it every year. They go out in their mobile dental unit. They have a dentist and I believe a hygienist out on their bus. They go throughout the state. I don't know how many stops they make a year, but they see a lot of individuals with intellectual and developmental disabilities. It's definitely a needed program in the state. And so we thought, I don't think there's ever been a survey done on those individuals, with the intellectual and developmental disabilities. Dr. Dane wasn't even sure if there was ever a survey done in the nation on these individuals. But we've contracted with Truman and the ELKS to get screenings for their patients, if they agree to it. So we have contracted with the ELKS Mobile Dental Program to get to have them to do screenings on their patients. And it works just like the PSP. It's the same form basically. And we are working on a report, but the preliminary data, it shows that over 52% had unsatisfactory oral hygiene, 80% have had tooth decay, and 42% had untreated decay. So we definitely know there is a great need for individuals. We are, like I said, we're working on a report, and that'll be out soon, hopefully, and be available on the website. Another screening survey that we're working on is for the older adults. And this is to screen people over the age of 60. You go to nursing homes or congregate meal sites in your state to screen the oral health of persons over that age. The last one that Missouri did was in 2009. We had planned to do this last year, but something came up, like a small little pandemic. So, of course, COVID delayed everything, and it was huge. So we have postponed it for the time being, but we are planning to do it now as soon as the nursing homes and the congregate meal sites open back up. We have been talking with the nursing homes and the congregate care sites. A lot of the nursing homes have had at least one dose of the vaccine, if not two. And we know who the nursing homes are. We know the congregate meal centers. Like I said, we've been in communication with them several times. We just sent them another communication, I believe, last week to remind them and to thank them for taking part in this survey. But we hope to screen at least 600 people over the age of 60. Hopefully that will give us an idea of the oral health of the older adults in the state. And the next slide just shows the map of where those nursing homes and congregate meal sites are. I don't know if you can see it. It is rather small, sorry, but the blue is probably the nursing homes and the red is the congregate meal sites. ASTDD, the Association of State and Territorial Dental Directors, worked with CDC to randomly select the areas in Missouri that we would have the survey go out to. And this is where all those nursing homes and meal sites are located. So it is a fairly good, around the state portion of Missouri. So we are excited to get to do that. We have contractors. They are all registered dental hygienists, and we have done a few nursing home sites and I believe some congregate care centers, but it's not enough to give any kind of numbers on just yet. But we are hopeful that our screeners will be able to get out there soon. All right, so what's the we know about the nursing home residents, we know that Medicare provides comprehensive dental care for nursing home residents. We also know that there was about 101,000 individuals 65 years of age and older who qualified for Medicare in nursing homes, but only 6% of these received dental services. Why? Well, we're not really sure. So we're hoping that the BSS for older adults will help understand the problem better. Maybe they just don't know that they're eligible. I don't know. Going on to the sealant program. So some of our contractors, the schools that they work with, they weren't willing to have visitors in the building last year, of course, because of COVID. So they have tried to do their best to get in or to kind of work around how best they can with COVID affected everything. And to keep people safe, obviously. So one contractor was actually bringing students to their brick and mortar clinic for the sealants and other treatment, but unfortunately the response has been low for that, but at least they were trying something. CDC has recently issued some new guidance for school-based programs that may help with us getting into the schools. We'll see. I know one of our contractors is going into one of their schools this spring. I don't know the exact date, but they are just going to do the screening, fluoride, varnish, and sealants, which is totally fine. They wanted to keep the aerosolizations, low. They wanted to, keep the possibility of infection transmission down. So they have just agreed to do the varnish screenings and sealants, which is fine. That's all that the contract really requires anyway. So we're excited about that. Hopefully they can get in there and apply a lot of sealants. We've also created some new educational materials in regards to sealants, and I think I'll show one of those pictures later in the next slide, but Gwen has been working hard on that. I know we've got a poster and some cards. So the sealant rate, what we have also found with PSP data from the 14-15 year until the 18-19 year, our sealant rate has gone up. Of course, that last number there for 18-19, that is from the BSS that we conducted in 2019, but we have found that the results from the BSS were fairly similar to PSP, the things that we have found. So our sealant rate has gone up by 5%, which we think, again, is awesome. So keep applying those sealants. We like to see that. Hopefully we can get that up there even more. So this is one of the cards that we are creating. It's just a little like an index card size. Once it's finished printing, then it will be available at the warehouse for you to order from the warehouse and to have in your clinic if you would like, or to hand out at any of your schools. But this is what one of those cards looks like. Okay, on to community water fluoridation. So the total number of community water systems in Missouri is a little bit over 1,400. And the total population on the fluoridated water systems is a little bit over 4 million. So the percent of population that are on the community water systems that are fluoridated is 76.46%, which is fairly good. I believe it is still above the national average, but we would like to improve that and increase that, and we are working on that. We've got some different things planned. And we are currently working with several water systems and several different partners to educate the public. And that's what I think a lot of this is. We need to educate the public. So the map, where are those water systems at, you may wonder. So this is the map, and this is from 2017. We did just get an updated map this week from DNR. We'll have that available on our website. But the blue dots represent where there is natural fluoride, and then the yellow dots represent where the water systems add the fluoride to the optimum level. So you can see they're kind of scattered out. Of course, the blue dots sort of follow the Missouri River, and then some other little areas across the state. But we are trying to increase those yellow dots. That is our main goal there, and especially to keep those yellow dots. So what are we doing to educate the public? So one of the things that we're working on is a media campaign. And by that media campaign, we are putting flyers in local newspapers. And this map represents the counties that have had those in their newspapers. The red represents the first year that we did it, which was 2009. The yellow we did in 2020. And then the green is the ones that are going out right now. So we've contracted with these newspapers in these counties to include an insert on the importance and the safety and effectiveness of community water fluoridation. And this is the insert that you can see. It's bright, it's cute, it's easy to read. It's just simple, which is what most people would like to see. I know at least I, for one, don't like to see a lot of words on things, but this, it catches your attention. It's simple and easy to digest. So once a month, these are going out to the newspapers, and it started, I believe, in February, and it's February, March, and April. And then we're also working on a radio PSA too. That is out there as well. You may have heard that on your local radio station. And this year we've focused on, again, those green counties. So you might hear our 30-second PSA that we have created, and the radio stations are playing. I've heard it on my radio station, and it's through it's during the peak hours. It's not just at 2 a.m. It's between 8 and 5. So it's good. It catches my attention because obviously the lady's voice on there just catches my attention. It's like, oh, I know what that is. So if you hear it, just think that's you're out there helping promote the community water fluoridation in the state. So I just wanted to give you a heads up on that too. Okay, and then something else, other things that we're working on within the office, education on oral and pharyngeal cancers. Nationally, about 3% of all cancer diagnoses are head and neck. And this increases about 10,000 per year. That's huge. The most common risk factors are tobacco and alcohol use. We do have a head and neck cancer webpage that is coming soon. I'm very excited about this. Callie Klein in our office has done a lot of research and has put together a webpage. It is full of resources, risk factors, questions, videos, pictures, all kinds of different things. So whenever it comes out, please check it out. I'm on an HPV work group, and that work group includes other people from Department of Health, namely immunization, the Cancer Consortium, American Cancer Society. We've all been working to increase the HPV vaccination rates, and then just to increase everybody's knowledge of HPV cancers. And obviously, head and neck cancer would fall under the purview of the Office of Dental Health. So we have created this webpage. Callie was the first to get it completed out of all that work group and all of the other different kinds of HPV cancers. So they have used ours as a template for the rest of the HPV pages. So we are getting close. Callie's finishing it up. We had a few little things that we needed to change, and it needs to go through the approval process, but we are very excited about this head and neck cancer page. And whenever it comes out, we'll let you guys know. So HPV is a new and increasing risk factor for head and neck cancer, as you may be aware. HPV is responsible for the recent surge in oropharyngeal cancer patients. The American Dental Society, AAP, CDC, many other agencies recommend HPV vaccination for the prevention of HPV infection. We are working with the Bureau of Immunizations to promote those HPV vaccinations. I came from the Office of Immunizations within the department, so this is something that is near and dear to my heart, is to increase vaccination. So if you have any questions on HPV and HPV vaccinations, please let me know, and I can put you in touch with the Bureau of Immunizations and some of those nurses down there. If you have some ideas, how we can increase education, centering around HPV, please let me know that. I'm very much open to that too. Okay, so our workforce survey and teledentistry. You can probably hear my dog growling in the background there. Sorry about that. Hold on just a second. Okay, sorry about that. Somebody is outside. Okay, so the Missouri workforce licensure statistics. So you can see we are getting better. Had an increase in the number of dentists, specialists, and hygienists in Missouri. So that's good. That's good news. That's what we need out there. The next map shows the dentists per county. And of course, what we're looking for there are those yellow counties. Those are the ones that have no dentists in them. And of course, it's probably not a surprise, but it is a lot of rural counties. Down there in the southeast part of the state, there's that little circle. It has been there for several years. This map is from 2019, and I believe that same little circle of Wayne, Reynolds, Shannon, Ripley, and Oregon counties have been there for have had no dentists for several years. Up in the north, it seems to fluctuate a little bit, but those are some very rural areas of the state, and they have no dentists. So you can see this map too. So this is always a good map for reference. Okay, so the workforce analysis. If you're a dentist or a hygienist in the state of Missouri, you should know, hopefully, you got your license this year. There was a survey on there. There were 10 questions that you had to answer. They were probably mainly demographic type of questions, where you reside, practice, those kind of things. But then there was the optional workforce survey. And if you completed that, I want to thank you, because that was with the Office of Dental Health. We are working, that's part of our HRSA grant, to do a workforce survey. So we worked with the dental board to get some survey questions out there. We had a 14% response rate from the dentist and 12% from the hygienist. And at first we thought, oh my gosh, that's terrible. It's hardly anybody. But we've been told that if we get anything over a 10% response rate, that is really good. So we are happy. We got 14 and 12%. So we're sticking with that. It's great. So if you completed it, thank you very much. But we are also working on a report for that as well. So we can go to the next slide, and I've got some different statistics there. So this is what we have found so far. Most of you are screening for COVID, and you're comfortable. This is the dentists, and you're comfortable with the COVID protocols. Most of you support community water fluoridation. Great. I wonder about the other 16%. That makes me wonder a little bit. We're working on it. 80% of you place sealants on eligible patients. 28% use teledentistry. And then of those, 53% use it about once a month. And then, the rest is kind of just a job satisfaction. 78% are satisfied or very satisfied, which is good. That's really good. And then 27% will continue to practice in Missouri for over 20 years. So that was among the dentists. And I've also got some numbers for the hygienist. Again, most of you are screening for COVID. It's a little lower on the comfortable with COVID protocols, but it's still a pretty high number. 70% place sealants, but of those, only 19% place sealants on most of their eligible patients. So I don't know why that number is so low, but that's just how it is, and we just need to get some education out there probably to increase that number. About 88% use teledentistry, which I found that a little surprising since the number of dentists was so low, but there's probably more hygienists going out there and probably working with just one dentist, which is what probably attributes to that high number among the hygienists, but that's just my guess. We're going to talk about teledentistry later on in the conference, and Dr. Suter is definitely an expert in teledentistry. He might have a better figure or reason as to why that number is. There's a little bit of a discrepancy there. Among the hygienists, most of them are satisfied or very satisfied in their career, so that's good. And then over 20% will continue to practice in Missouri for over 20 years as well. All right, so speaking about teledentistry, so it is happening in Missouri. It is definitely a reality. And what it is if you're not familiar with it, I'm going to go through it again anyway. The dentist supervises a hygienist in a remote location. There are two different forms, synchronous and asynchronous. Here in Missouri, I believe it's just been the asynchronous, where the hygienist goes out and basically does a triage of the patient, uploads data so the dentist can see it at some later point, that evening or whatever, and then the hygienist will go back out there and do what they can. Again, they're going to talk about teledentistry later in the conference, so I don't want to get into the nuts and bolts of this too much. So the Dental Practice Act was modified in 2017 to allow teledentistry. In case you didn't know, I believe Dr. Deaton was instrumental in rewriting that Missouri Dental Practice Act. So that's exciting. So this is a potential to expand access to care by allowing hygienists to work in nursing homes and schools. And that's what we're doing with our contracts, namely the HRSA Workforce Grant. So we're in year 3 of that 4-year grant. We have 6 contracts to provide dental teledentistry services, 2 at schools, 2 at nursing homes, and then 2 there with the CDC grant, but they are to place sealants and some other services at schools. That was their choice, but through CDC they just wanted sealants, but the contractors have said, well, since we're there, we're just going to do other services as well, which is great because it's definitely needed. We've also got 3 contracts that are soon to be executed to one entity. They will be doing the HRSA Workforce Grant. They will be going to schools and nursing homes to provide care there, and then we'll also be going to those same schools to provide sealants. So they have got both the HRSA and the CDC contract for that. We also had some teledentistry workshops in person, November 2019, and then we also had an online one that Dr. Suter and Tiffany were the trainers for back in September of 2020. So that was exciting, and we've had some webinars, 3 in 2019. So those are the activities with our teledentistry. And in case, that just kind of, piqued your interest, the stuff that I went through today, you can read the burden report, or surveillance report as it's also called, on our website. And that goes into all of these things that I touched on today in greater detail than what I ever could in an hour speaking. So the burden report is on our website. All right, opioids in dental practices. So the biggest problem for dentists, well, I shouldn't say the biggest problem for dentists. I don't know. Well, yeah, that's what the slide says. Biggest problem for dentists is misused opioid prescriptions. So most of the people with the opioid issues, most of them got their opioids free from a friend or family member. Of course, we know how that goes. Somebody has some leftover from some dental procedure or some other procedure that was done, so they give it to somebody else who's having some issues. Not necessarily what we want, so we have been educating and wanting dentists and doctors to decrease the amount of opioids that they give. And how we do that is by asking them to give a less of a prescription and for less days. So the next slide, you can see the chart shows the days of the prescriptions that the opioids from the dentist that have gone down for the last 4 years. The average days has gone from 3.5 days to almost 3, but it's still gone down, so we'll take it. But you can definitely tell that it's making a difference. And this slide shows that in the past 4 years, the quantity of the opioids given has also gone down. It's only by 0.7, but that's okay. It's still gone down. It's still quite a jump. So we will take that too. So the efforts to change the opioid practices related to dental practices, like I said, the fewer opioid prescriptions is what we're working for. And what that's led to is a reduction in the emergency department visits for non-traumatic dental complaints. The changes in the Dental Practice Act to limit the prescribing of opioids by dentists, along with some educational campaigns, that's also led to some of the fewer opioids that were given. We're also raising the awareness of diversion problems when prescribing opioids. We hosted an online diversion training in November November of 2020. That was in conjunction with the coalition. We had Dr. Bill Kane speak on that. It was a very good presentation. And then we're also working with the DEA and the Bureau of Narcotics and Dangerous Drugs on their educational series. So those are the things that we're doing with, decreasing opioids in the state. All right, Missouri Medicaid. So, and I will just tell you this, that I am not a Medicaid expert. Hopefully Dr. Dane is on, and he has graciously said that he would answer some questions if there's any questions on Medicaid, but I will go through these numbers for you. As you may be aware, most of the Missouri Medicaid dental providers are in FQHCs around the state, and that's what this chart shows. That's where most of those Medicaid providers are. And the next map shows where they are around the state. So the darker the blue means the more Medicaid providers. And, it should come as no surprise, more of the Medicaid providers are located in St. Louis, Kansas City, and the Springfield area. And like I said before in the slide, or in the presentation, unfortunately, a lot of our rural areas, the children there have the greater need for the oral health care services, and many of them, are in the rural counties. 54% of the Medicaid participants reside in rural counties, so it's a struggle for them to find Medicaid providers, and that's what this map is showing there. What have we learned from non-traumatic dental visits to the emergency department? So everybody loves to talk about this and how much it's decreased. So adult dental services started in 2016, and from January of 2018, we have seen a 44% decrease compared to January of 2015. That is phenomenal. The rates per 100,000 are 38% lower. And, people may argue, well, there's less Medicaid participants. Well, no, there's not. It's close to the same. So this shows you that adult dental services, adding that benefit, has definitely had an impact on the ED visits, the non-traumatic ED visits to the department. The next slide is just a graph that depicts these numbers. That I don't know if you can tell the different colors, but that very bottom one, that's only like a half, that is from 2020. Of course, you can see in March there, when everything shut down and people were staying home, that number definitely went down. It is starting to go back up, but it's still definitely a lot lower than what it is in any of the previous years. I believe the first year is kind of more of a black line, 2013. It's up there towards the top. So we have definitely seen some great things come from providing the adult dental services with Medicaid. So the next slide just gives you kind of a little quick snapshot of the number of services provided to the percentage of people. These are all up a little bit from 2018. The only one that's down is that one that's in red down there, and that's the total eligibles receiving oral health services provided by a non-dental provider, which namely is like WIC fluoride varnish clinics. The fluoride varnish clinics within the local public health agencies, they do bill Medicaid, so they would be a non-dental provider. Most of them do not have dental providers there in their LPHAs, so they would be the non-dental provider, and we are working on getting that number up. So hopefully it is increasing. This year, I don't know how much it will because they weren't in-person visits, but we're working on it. Okay, the AHR ranks Missouri as 41st in maternal oral health. Not a good number. So what can we do? What do we know about that? So MoHealthNet provides comprehensive dental care for pregnant women and 6 weeks postpartum. I don't know if they are all aware of that or not. Hopefully they are. But what we know is that in 2016-17, there were almost 57,000 pregnant women on MoHealthNet, but only 16% of them had one dental procedure between 16 and 18. Not a good number. So we are trying to increase that, namely Department of Social Services MoHealthNet division is trying to increase that So how do we do that? Well, we have to identify the outstanding barriers that prevent them from going, to an oral health visit. Maybe they're in the rural parts of the state and they have a hard time finding a provider. Look at the claims. Maybe they've got some other oral health conditions that prevent, or some other health conditions that prevent them from oral health visits. We need to provide some outreach and promote incentives to encourage the pregnant women to seek the oral health visits. And then we also need to encourage and engage the Medicaid providers to provide those services to pregnant women. One of the things that MoHealthNet did was they did a secret shopper survey of dentists about access to care for pregnant women. Just ask them questions like, do you see pregnant women? Why not? Or why do you? Or different things like that. So they did the secret shoppers. So they found out some interesting things there. They also plan to survey the MDA members about treating pregnant women. And there was also an article in the Missouri Dental Journal, The Focus, on the dental care for pregnant women, just to encourage providers to provide care to the pregnant women. I believe they're also adding the dental visit to the checklist of information that's given to the pregnant women. And they also did a pilot program to send mailings to pregnant women in Cole County, advising them of eligibility for dental services. Now, I don't know if they did it for any other counties. I just know Cole County. And in Cole County, they did this in December of 2019. And the next slide will show these numbers. They did in December of 2019. The number of postcards that were mailed was a little bit over 200. And number of members with a dental claim was 41% as of October of 2020. So that's a big jump from the statewide average of 16%. That probably helped. I don't know what Cole County's rate was before this, but I believe this 41% is a lot higher than what it was before. So it's different things like these postcards that need to be done, probably just to let the pregnant women be aware that they have this service available to them. And I believe this was the postcard that was used. And then the next slide shows the back side of the card. It just tells them how to make an appointment, why is it important, and what services are covered, which is what they really need to know. Something very quick, down and dirty. And there you go. So different ways to improve dental care for pregnant women. We are continuing with the established communication methods. We are looking at resources that are currently available. We're also trying to create some different things, social media platforms, individual flyers to members, text notifications, outreach by phone call, different things like that, just to, the outreach among the pregnant women and the providers to make sure that they know that it is important for pregnant women to use the dental services that are available to them. Okay, so I think I almost did this in an hour. So, like I've said, I don't know about you, but I am excited about everything that we are doing in the Office of Dental Health. We have made a lot of improvement over the past few years. We still have a lot of improvement yet to come. We have a lot of current projects to do. We are working on many current projects now, but with the enthusiastic community partners like everybody on this conference, I think we can get this done and come up with some ways to improve oral health among Missourians. So I probably didn't leave a whole lot of time for questions, but I tried my best, Gary, to slide it in as short a time as I could. So, all right, if you have any questions, I am available. I know Dr. Deaton is on. I have not seen if Dr. Dane is on or not. But if you have any questions, please let me know.
I'm going to stop sharing the slides, but just to remind you, the slides are available on our website. And we would welcome some comments. It looks like Dr. Dane is on and has made a few comments in here. Well, there's a lot of comments. Maybe Ashley can help with that. I haven't been able to view the chat while I was in screen share mode, so.
Sure. One of our questions that has come in that I haven't seen a response to yet is for the oral health services data slide from CMS. Can you speak to how these numbers compare to the oral health objectives? How is the state doing compared to national objectives?
So is that the slide that shows the different services? I don't know right off. Dr. Dane, do you know right off how it compares to the national objectives? Otherwise, I can find it out, hopefully.
No, I don't know how we compare nationally, but when you look at only 35% of the eligible children in the state are receiving any dental services at all, doesn't matter how we measure up to the state, that's terrible. And it's been terrible for a long time. When I took over in 2016, it was at 33%. So yes, we have made a slight improvement, but I know there are states out there that see over half of their eligible children. So I know Missouri's can't be rated very highly on that, but it's something that can be compared and find. You can look and see.
Thank you for that, Dr. Dane. I'm just looking to see what else hasn't been addressed yet. Dr. Booman did have a comment that maternal oral health also has a direct impact on pediatric oral health, both for the positive and the negative. So it's exciting to see more outreach being done to expectant parents.
Yeah, I think just to add a little bit to that, Dr. Booman, I'm sure you know this, but if a pregnant woman goes to the dentist, it's more likely her child will also go in to see the dentist too. So that's definitely another reason to increase those visits.
Yeah, absolutely. I mean, there's a growing body of literature out there that really the healthier the parents are, like not just oral health, but like general health, like the more access that they have to healthcare services, the more likely their children are to have access to services. And then, I mean, we're talking about breaking wheels here, people. That's the deal. Like breaking cycles. That's what it's all about. And that is like really exciting stuff. Because to me, like Dr. Dane was saying, like we only see 34% of these kids, and if we're going to make a big difference, I mean, yes, we've got to increase that number, but like if we're going to also, I mean, prevention's got to be a huge part of that, because in the meantime, while we get that number up, hopefully we're preventing honestly, the 3-4 kids that I saw this morning that I'm going to be taking to the operating room later on in the year. So that's what we're trying to prevent. So thanks.
And yes, those slides will be shared on the website after we get everything uploaded from the conference. And then Dr. Oka, thank you for letting us know that the AAP is currently wrapping up a 2-year pilot project introducing oral health services into prenatal practices. So hopefully that can be expanded. Thank you. And we encourage you to continue to add questions and comments to the chat. We've got a few minutes still.
Julie, I'll note you got, there was a lot of comments because you covered a lot of material, some of which have been answered in the chat itself.
Okay.
And also, just to let you all know, there will be a recording of this session available later on the website. While we're pausing to see if there are other questions or comments, I will note that the CEU code that you will need to enter on the CEU survey for this session is OFFICE, OFFICE, as in Office of Dental Health. And you can find the link on the website on the agenda page as well as the times. Dottie Golson asks a question. How can we get the pregnant woman Medicaid dental card?
Dane,
I'm
do you
not.
know that? Or somebody else gonna answer?
I'm not sure what she's asking. She said dental card. I think she means dental care. Um, the she's not even. That's been problematic. There's a lot of individuals who the tribal knowledge, if you will, is that you don't go to the dentist while you're pregnant, and so they don't. Um, Getting the information in their hands. One of the studies that was done back in New York State showed that many of the women that didn't seek dental care that had access to it didn't realize that Medicaid covered dental care while they were pregnant. And so that's hence the effort we're trying to do with MoHealthNet to get that information in their hands. There are still dentists out there that think that because a woman is pregnant, they can't do dentistry on that person. And that's unfortunate. But there are lots of individuals out there that there are just various little barriers to getting into a dental office to have even a checkup done while they're pregnant. And just have to work at them one at a time.
I will add, while you're talking, Dr. Dane, it made me think the Office of Dental Health does have a C card, and I believe that card does say that dental benefits are included in Medicaid. I'll try to get a picture of that card or the link to how to order some of those cards. I'll put it in the chat.
Julie, if you happen to find that link to put in the chat for those postcards, we did have a couple people asking how to go about ordering those.
Okay, because those postcards that I showed, that was from MoHealthNet, and I'm not sure if those are available, but we have some little cards, leave behind cards we call them. So, all right, thank you.
All right, I think we have probably reached the end of the presentation. Thank you, Julie, very much, and thank you, Dr. Dane, for stepping in there a little bit for no pay. Although I do notice that you are dressed very comfortably, and that may have something to do with retiring from the state. I don't know. Maybe it's unrelated. So I have given you the code, which again is Office for those of you wanting to get the CEUs. The slides for this presentation are already available on our website. You can go in there and find that, and then again there will be a recording available. I think that we are going to go on break so you can get lunch. We'll be back at 1 p.m. Sharp for Dr. Scholand on a great update on COVID-19 vaccines. We think that's all very relevant, and you'll find it very informative. And I believe Ashley is going to try to run our thank you movie right now, but you are on break. And again, I urge you not only to get lunch, but please get away from computer screens and phones for a while. Too much technology is bad for your health.
Before we run to break, we do have a sponsor focus that we would hope you would stick around for. Delta Dental is a gracious sponsor again this year. Stacy, Jessica, would you two like to have a few minutes to tell us a bit about Delta?
Sure. Thank you, Ashley. Let me get my screen pulled up here. All right. Can you see my screen? Can you see my screen?
Yes.
Oh, perfect. Okay, great. So hello, everyone. My name is Stacy Harris, and I'm the Supervisor of Community Outreach for Delta Dental in Missouri. And I just wanted to start off by thanking the Missouri Coalition for Oral Health for all of their hard work on this conference. We really are very proud to support the conference, and we are happy to see that you're able to offer it virtually. I also want to thank them for the opportunity to connect with you all and be able to share more about how Delta Dental of Missouri is working to advance oral health. So hopefully this presentation will help to answer any questions that you have and about our charitable giving efforts. And we're always looking to support new organizations and projects that will improve oral health in Missouri communities. So Delta Dental of Missouri is a nonprofit organization with a social mission to improve oral health in the communities that we serve. And this mission really drives us in our charitable giving efforts. So we support our mission through grants and donations to nonprofit organizations and government agencies, as well as educational programs and resources that are focused on improving the oral health of Missouri, really with a focus on underserved and at-risk populations. So the majority of our charitable giving is through our oral health grant program, which supports organizations working to reduce oral disease through treatment, education, prevention, expanding access to care, and really just spreading awareness of the importance of good oral health. And the grant program offers one-year grants that range from $5,000 to $100,000, and we have 2 grant cycles each year. One is in April this year and October. And grants are generally awarded for program restricted, capacity building, and capital. And then we also consider unrestricted grants as well. These grants are awarded statewide. However, we do prioritize programs that are serving counties with the highest need. So we've evaluated the dental health professional shortage area data from HRSA to really identify these counties, which I'll share with you on a later slide. So I've included the link to the Oral Health Grant Program website here. And this site really includes our guidelines for the program and details that may just be helpful if you're interested in applying. And also, I encourage you to reach out to our team directly if you have any questions as well. So we also support nonprofit organizations through our community giving program. And this program really invests in organizations that are supporting the overall health and well-being of in-need and at-risk populations. And many of our event sponsorships are supported through this program. So there's a short online application for this to complete, and staff reviews these requests quarterly. And organizations through this program are eligible for donations up to $5,000. We also provide nonprofit organizations with oral health supplies like toothbrush, toothpaste, floss, and those are for populations in need. And applications for this are accepted on a rolling basis throughout the year. So another way we support our communities is through education. So in 2002, we began offering the Land of Smiles educational touring program. And this program visits elementary schools across the state of Missouri and teaches children in kindergarten through 3rd grade how to take good care of their teeth and have a healthy smile. So the LIVE program has educated more than 1 million students in Missouri since it began. So when COVID hit, our team, like the rest of the nation, was really not sure what the school year was going to look like. So we knew we had to find a solution to keep offering the program. So we pivoted to the virtual program in September 2020, and we'll continue offering that through the spring of 2021 semester. We're just really excited about how well the program's been received by schools across Missouri, and it's been completed by more than 61,000 students and has reached more than 80 counties across the state. So we were really happy about that. So if you know any schools that might be interested in scheduling the program, I've included a link to the program website on the slide, which also includes a preview of the program you can view, or you can email me directly and I will have our scheduling team reach out to them. So another way we support our mission is by connecting people in need to our communities with no cost or low cost dental care. And so we do this through our dental care resource guide. And this guide is a comprehensive list of dental care options in the regions of Missouri. And we really began publishing this guide because we were receiving calls from individuals that were not able to find free or low cost dental care in their area. And we recognized that transportation was a common barrier with these individuals. So we thought having a resource with local providers would be helpful for them. So we update this guide in Q4 every year. And I've included a link here to the guide on this slide. If you're interested in seeing the guide or just sharing the guide, that would be great as well. So a priority for us in 2021 is to continue to expand the reach of our charitable efforts. And this map shows the reach of our program since 2018 and also counties that we have targeted in 2021 based on the need that's identified through HRSA data. So the green counties show our Land of Smiles program reach, and Scotland County is the only county that that hasn't received the program in a live or virtual format. So this is really a priority for us in 2021. And then the teal counties are the counties impacted through our grant funding. And then the red stars indicate the counties we are targeting in 2021. And I've also listed those counties here. So please let me know if you know of any organizations serving these counties or interested in serving the counties. We would really love to connect with them. So here is the contact information for our team. If you have any questions about the information or programs I shared today, you can email me and I'd be happy to share more. Again, I want to thank the Coalition for Oral Health for the opportunity to connect us all today. We really appreciate them and value their work and role in improving oral health in Missouri. And I look forward to connecting with any of you that feel our programs might align with your organization for planning in 2021 or beyond. So thank you very much for this opportunity, and I hope everyone has a good afternoon.
Thank you, Stacy. Really excellent presentation. And I don't know if we have a copy of your slides. Would you send those to us? We'll get them posted on our website as well. We'd like to do that so people can look back on that material.
Absolutely. Yeah, thank you for doing that.
And we very much appreciate your support for the coalition in this conference. So now you do have a lunch break back at 1 o'clock. And again, I please urge you to get away from the screen for a few minutes and get up and walk around at least. So we will see you in a little bit. Thank you.